Hello, I'm Chelsea Whittington here with another episode of Mental Health Awareness Month here at Edgewater Health. I have a special guest who's on the Edgewater team, Miss Leshaya, and she's going to tell us all about what she does and how she's making a difference in the communities that Edgewater serves. Hello, Leshaya, please introduce yourself.
Hi, so I am Leshaya Homan. I am the Director of Addictions.
Director of Addictions. How long have you been with Edgewater Health?
For almost a year.
Almost a year.
Yes.
So that's a very interesting title, Director of Addictions. So we have a little time here to chat. Please share with me exactly what your role entails as Director of Addictions.
Yeah, so as the Director of Addictions, I am over two of our programs, both addiction services. One of our programs is our medical assisted treatment program, where we offer our clients methadone. We offer methadone and buprenorphine, and those are for people who are really struggling with opiate use disorder.
Okay.
We also have another program, which is our court-ordered program, where people are kind of ordered to be here by the courts.
Okay. So when you talk about the clients that you serve, tell me in detail how the clients arrive to get services from you. Are they recruited? Are they reported? A combination? Just walk me through that.
So I would say it's a combination. Some of our clients are reported through the state, through the state, or sometimes they're coming from the court. Other times we have like people like LADOs who may refer people over to us. And then we also have it where some of our clients, they're just here voluntarily.
Yes.
They noticed that something was not exactly right in their lives, so they decide to come here for services.
Okay. And I always wonder, because we have these services available at Edgewater Health, sometimes there's that stigma or that hesitancy to say, I have an issue, I need to help. Are family members or close friends also sometimes those that refer your clients?
Oh yes, we definitely get a lot of family members who may walk their loved ones in and say, hey, they really need help, and wherever they come from, we gladly accept them.
Okay, that sounds good. If you're just tuning in, hello. We are here with Miss Leshaya. Addictions. That is a sensitive topic, obviously. What led you into this role? Talk a little bit about your education, your background, and how you arrived at Edgewater.
Yes, so when I first started off in my career, my master's is in social work. So I started off actually working with children. So I've been working with children for a long time. I was an RBT for a while, and then once I got my degree, I started doing child therapy.
Can you tell me what an RBT is?
So RBT is a registered behavior technician.
Okay.
So we work a lot with children who are on the autism spectrum. Yes, so I did that for a while, and then I switched over into becoming a child therapist, and now I am working in addictions.
Very good. You are clearly very young, so you're new into the program.
Yes.
Are you originally from the area?
No, I'm actually from Minnesota.
From Minnesota. What brought you to Northwest Indiana?
So I actually came out here to be closer to my mom. So I moved here.
Family.
Yes, moved here for family, and then I just ended up staying. I like the area, so here we are.
What are some of the things that you like about Edgewater Health and its mission?
I like that Edgewater is trying to create as many services as possible for our clients. And I love that they're really doing the outreach part and getting some of the neighboring facilities to kind of come in and help and kind of just do those referrals.
Yes. So back to your role as Director of Addictions. When you have a client that comes in or newly registered, walk me through that process. I know there's steps. You just don't start to administer prescriptions and things like that. I'm sure there's steps to this. And someone who may want to refer someone would probably want to know, well, how does it work before they move forward with reaching out to you?
So typically, if a patient is coming in and they need services, the first thing they would do is call our front desk people, our admission specialists, and they will schedule them for an intake. The patient will come in for an intake, and then that's where they meet one-on-one with the therapist, and we just kind of get some of the backstory on the client, where they're coming from, what they're currently using, and then maybe like if they've tried to try methadone as a box, and if they try any other mat forms, we get that kind of information. while they're with us, they'll also see the nurse, and the nurse will do that portion, so they get like the background on their medications, and if they're currently seeing a doctor, and if not, then we refer them to one of ours, and then they'll see our doctor, who would then, they kind of have the final say on if the client is accepted into the program.
Okay, and then being accepted into the program, is there a cost? Do they have to have coverage, or is there an assistance to help those who are suffering from addiction?
Yeah, so we accept all forms of payment. I'll start there.
Okay.
So most of the insurances offered in Indiana, we accept those. If a patient does not have insurance, or they're self-paid for whatever reason, we do have a sliding scale. And then we also offer DEBS, which is state funding, who will kind of pick up on any charges that the client is not able to cover for whatever reason. And that's offered for our clients who are self-pay.
Okay. Now again, this word is addictions.
Yes.
We talked about, the methadone and the opioid piece, but do you also address other types of addictions with clients?
Yes, so we address all substance-related addictions. We do offer the tobacco cessation as well, so any patients who are struggling with tobacco use, nicotine use, we offer that. And then if it's like maybe a behavior addiction, so we're thinking like gambling or something of that sort, we can help with those.
Oh, that's very good to know. I was thinking specifically drug-related, but there's smoking, there's the gambling.
Yes, we do the cocaine, the benzodiazepines, whatever. And if it's something that we are not able to help out with an outpatient, we also offer inpatient services, which would be the RAC.
Wonderful. Talk to me a little bit about confidentialities. Sometimes you have individuals, and this is a small-knit, close-knit community, where they want to get the help, but they're kind of worried about, what if someone sees me here, or how do you keep my files and records? I know by law we're supposed to, but just that somebody seeing me walking into the facility or things like that. What measures do you have in place that help with confidentiality?
Yeah, so confidentiality is very important here, especially in the clinic, right? Our clients want to know that they're safe and that no one's going to really know their business. So we do take that into consideration. So we try to keep anything with the client's name or any of their files, we try to keep that stuff private. We don't release any information without the client say so. And then there's also, like a client would have to have someone added to their records, and they have to tell us like, yes, I want this person listed as a support person prior to us giving out any information. And as long as we have written consent from the client, that's the only time that we can release anything.
Okay, well that's always good to know that the programs.
Unless they're a danger to themselves, a danger to others, or there's a safety concern.
Gotcha, where there's law enforcement involved, etc. We're chatting with Ms. Leshaya, talking about addictions. If people want more information about you and your program, how do they reach out? Via social media, website, phone numbers? How do we find you?
Yeah, so they can always go into Edgewater's website, Edgewater Health. Then we're also on all the social media platforms, and if you guys want to get in contact with me, my email is lhoman@edgewaterhealth.org. You guys can also call the call center and just ask to speak with me.
All right, sounds good. And I'll circle back with that one more time, because we are still talking addictions. For us who are not in your profession and maybe have a family or friend that we're kind of thinking something is going on, are there signs or symptoms that we as the village around to support someone else that we can look for any of the different addictions, alcoholism, gambling? What are some of the signs that we should be looking for? And I know that runs the gamut, but people get interested, like, I want to help my loved one. What am I looking for? Am I being paranoid when I see them doing these certain types of behavior, or am I potentially on to something?
I would say increased use of substances. If you notice them using more pain medicine than they typically take, or if it's more than what the doctor originally ordered, something like that. If you notice constant issues within the family unit or with their friends, like they're slowly starting to isolate themselves, things of that sort.
And then like with the gambling, I'm like, obviously you're going to these casinos a little bit more, or the monetary piece. A lot of times we find those who are having financial issues. It's like, well, what are you spending your money on?
Yes, if we're thinking of gambling, so if they are often in need of help with money, if they are often spending their time or their money in a casino, those are signs.
Those are definitely
Yes.
signs. Well, I know that addictions run the gamut as far as the different types of addictions, but it's always helpful to have that information. And I'm sure the website and talking with you and the information that you share with your various communities lets us be a help to those who need that help. So one more time before we get out of here, please tell everybody your title and how we can find you to help those that we want to help.
Of course, so I am Leshaya Homan. I am the Director of Addictions, and then of course, if you guys need to contact me, my email is lhoman@edgewaterhealth.org, and you guys can also call our call center and just ask to speak with me.
Sounds great. And don't forget that website, edgewaterhealth.org. I'm Chelsea Whittington. Please be sure to share this video in honor of Mental Health Awareness Month. Thank you to the team at Edgewater for all that you do. We will see you next time.